Good afternoon, everyone. Welcome to our Thursday afternoon webinar. I'm Melinda Bikini. I'm the Director of Patient Services with the Cholangiocarcinoma Foundation. I'm also a long-term survivor of stage 4 intrahepatic cholangiocarcinoma. I'm excited today to be joined by Lillian Rodich. Lillian is going to be talking to us about integrative medicine in the oncology setting. Lillian is a PA who has been working with oncology patients for the last 10 years. She received her Bachelor's of Science in Nutritional Sciences from the University of Arizona and uses this background as a backbone of the medical care she provides. In 2021, she joined the Integrative Medicine team at MSK, where she now sees patients from all oncologic settings to counsel them on integrative approaches. We are happy to turn this presentation over to you. And as always, please put your questions in the Q&A chat at the bottom of the screen, and we will get to them at the end of the presentation. And again, please try to keep your questions general in nature, as Lillian won't be able to answer any personal medical questions. Thanks so much, Lillian.
Thank you, Melinda. Thank you, everyone, for having me on today and for taking the time to come listen to integrative medicine. So the audience for today is, of course, our patients of cholangiocarcinoma, members of the foundation, family, friends, and caregivers. Just a couple of quick disclaimers. Like Melinda touched upon, I will not be able to give any individual medical advice today, and we will review supplement use, as I know many of you would like to speak about that topic. I won't be able to speak about specific brands though. And just to note, I have no financial disclosures or brand partnerships to note. All right, so integrative medicine. What is it? So cancer patients are very interested in complementary therapies. And when used properly, they can really help improve patients' lives. They can help reduce symptom burden, and they can even help us providers be able to better address really difficult to treat symptoms. Today, we're going to discuss the field of integrative medicine and what it entails, when it should and shouldn't be used. And we're going to review the advances of this field over the last few years and how research has really made it possible for integrative approaches to become standard of care as part of their treatment plans. We're also going to review common modalities and therapies used within integrative medicine and some of the common symptoms they're often used for. So I'd like to start off with this slide to highlight just how prevalent complementary therapy use is. We have it here assorted by age. And even though this slide is from 2007, we know that this complementary therapy use is only getting higher. So these numbers are very likely even greater today in 2023. We know that the average age of our cholangiocarcinoma patients is noted to be 70. We do believe it's a little bit, younger over the last few years. And so we see that a lot of these high groups are going to be relevant to cholangiocarcinoma here. And so what kind of complementary therapies are patients looking at? So the modalities that we use at Memorial Sloan Kettering, and every integrative service is a little bit different, but the approaches that we use are, of course, our provider consultations so that we can best address different symptoms and be able to give specific recommendations. We utilize acupuncture. We use mind-body therapies in different modalities, including dance therapy, music therapy, exercise and movement, urban supplement counseling, and massage therapy. This slide really highlights the increase over the last few years of evidence and research that has been published in all different groups of integrative medicine, whether they're the mind-body practices like meditation or herbal supplements. We see this very high rise in research that's being done and published on these modalities. So this really goes to show that these modalities are not only just being used more often, but they're being spoken about and asked about more frequently in the medical field. And so research is really stepping up to be done to show that these modalities are safe and effective. So let's review then what integrative medicine is. I always say we can't really define integrative medicine until we define health. And the World Health Organization, they define health by a state of complete physical, mental, and social well-being, and not merely the absence of disease. And I think that's so important to know, because integrative medicine provides a holistic approach that addresses health in all of these different aspects. And so those two things are so intertwined. The idea of overall wellness and health, and integrative medicine really trying to approach all of these different aspects. And here I'd like to sort of give a little bit of definition. So you'll hear a lot of different words being used interchangeably. So the word integrative and complementary are oftentimes used. The word alternative is something that we are trying to stay away from a little bit because of these differences. So integrative medicine is really meant to be used as an evidence-based complementary approach alongside conventional standard of care treatments. It's meant to be non-invasive, relatively inexpensive, and it's meant to focus on side effects, management of symptoms, and health during and after treatment. On the other hand, alternative medicine can sometimes be promoted for the use instead of conventional therapies. It can oftentimes be very costly, have unsubstantiated claims, be invasive in some ways, and also be touted as curative rather than just focusing on improving symptoms or improving side effects. So we do want to just make note of those two differences and try to stick with the language of integrative and complementary therapies for this. So what are the most common modalities used in integrative medicine? So for today's talk, we're going to focus on acupuncture, mind-body therapies, herbal and supplement care, and nutrition. So acupuncture. So according to the NIH, acupuncture has been used in some form for the last 2,500 years at least. So needless to say, this is not by any means a new modality that has been around. So I like to point out the two different ways that we think about what acupuncture is and how it works. In traditional Chinese medicine on the left here, we have acupuncture being seen as a technique for balancing the flow of qi or energy throughout the body so that it's better flowing through our meridians. And you can see those meridians on the picture on the left here and how they are all interconnected. On the other side, in Western medicine, we believe that that acupuncture points are used as places to stimulate connective tissue, nerves, and muscles. And when these areas are stimulated, anti-inflammatory cells go to those places. They help to reduce pain, inflammation, and can help promote healing to those places. So two different sort of schools of thought, but both really working on the same pathway overall. Some of the symptoms we most commonly use acupuncture for on our service, and that we have plenty of clinical trials and evidence to show that it's effective for them, include pain, fatigue, trouble sleeping, GI symptoms like constipation, nausea, vomiting, peripheral neuropathy, a very common side effect of chemotherapy, dry mouth, and hot flashes. By no means is this an all-exhaustive list. There's many other symptoms that may be targeted and treated with acupuncture. These are just some of the most common ones that we see. So what are the benefits of acupuncture? I always like to start out with the fact that we can so safely use acupuncture during active treatment, which I think is a huge benefit. There's not going to be any kind of negative interaction or interference with treatments, including chemotherapy or immunotherapy. It can safely be used during radiation. We can focus on multiple symptoms at once, and the results are long-lasting and cumulative. The only downsides I could think of are that sometimes it is not covered by insurance, so there may be a cost involved. And this treatment may need to be held if counts such as platelets or the white count are too low due to treatment. And we would need to wait for those counts to recover before we're able to safely use acupuncture needles. So I touched upon, research and how it's really advancing this field of integrative medicine to help it be standard of care. So this is exactly what I mean. Earlier this year, we had a panel of experts come together to create a consensus that there was enough evidence to create this guideline and this recommendation that acupuncture and reflexology or acupressure can be recommended for general cancer pain or musculoskeletal pain. This is now an official recommendation by ASCO, the American Society of Clinical Oncology, and these recommendations are based on an intermediate level of evidence with the benefit outweighing the risk and a moderate strength of recommendation. That's a really big deal for us at Integrative Medicine to be able to have such a strong recommendation from such a group, showing that there is enough research behind this kind of modality and it can help such a significant symptom. Now switching gears a little bit to mind-body therapies and what those are. So some of the mind-body therapies that we have and that we focus on include meditation-based therapies like mindfulness, guided meditation, and walking meditation. This includes breath work, music, and dance therapy. Some of our movement therapies like yoga, tai chi, and qigong, as well as aromatherapy. Some of the most common symptoms that are improved and helped by mind-body therapies include stress, sleep disorders, depressed mood, pain, anxiety, and general quality of life. There has been a lot of research that has gone into mind-body practices. We see in mindfulness-based stress reduction that this can really improve cancer patients' psychological adjustment to their disease. It can help relieve anxiety, fatigue, help mood and sleep, and improve that overall quality of life. Guided imagery, on the other hand, we also have studies looking at something as important as anti-cancer immune defense markers and noting that these are improved when we use guided imagery in breast cancer patients undergoing treatment and even in pre-surgical prostate cancer patients. I've added a guided imagery meditation here, and I'll link it at the end as well if you all want to take a look at that. Aromatherapy. So aromatherapy is a really commonly used complementary treatment. And I did want to highlight this one because I feel like aromatherapy is something we oftentimes talk about, but what do the studies show? Is there actual evidence behind this kind of therapy? And in fact, there is. There's a lot of different studies showing the positive effects of aromatherapy and essential oil use. We see in human clinical trials that this could help relieve stress and anxiety in patients. And some of the most commonly used essential oils include lavender. We use that for sleep issues, stress, and anxiety. And then peppermint oil for the use of things like low appetite or nausea. Jumping gears a little bit now to nutrition. So nutrition counseling during an integrative medicine consult can focus on many different things, including during treatment, maintaining weight and caloric intake, adjusting food choices and helping the patient figure out what it is that they can be tolerating and eating when they're having GI-related symptoms, including things like nausea, constipation, abdominal pain. We can talk about nutrition choices to help lower recurrence risks, such as higher fiber diets, lower glycemic carbohydrates, lower saturated fat diets, etc. And then talking about the use of whole foods and nutrition versus relying on supplement use. And so what I mean by that is a lot of times on our consults, we'll have people ask, should I be taking this supplement? Should I be taking that vitamin? And instead of relying on just that vitamin and supplement use of it, we want to think about how can we get these kinds of nutrients through our whole foods the best that we can. So the right nutrition plan is going to look different for everybody, depending on their treatment, depending on where they are in their treatment, if they're in the post-operative status, depending on the symptoms that they might be having, including nausea or low appetite, and weight. Our focus is always going to be on the diversity and variety of foods. This is going to help diversify our gut microbiome, which is a really important factor in all cancers. And we really want to emphasize the diversity of food versus superfoods. So I wanted to just touch base on that a little bit, because this is really a question that we get all the time. Let's use acai, for example. We get the question all the time for something like, I read acai is a really powerful antioxidant. Should I be eating that multiple times a day or multiple times a week? Now, instead of relying on just that superfood, we want to think about, well, what is acai? Why is it so powerful? What nutrients are in it that's making it have such a great effect? Now, if it's something like vitamin C, if it's a high fiber, if it's another kind of nutrient that's in it, then we want to look at what are some other foods that are really similar to that may not be getting that kind of marketing, and then that may not be getting the same attention, but are equally just as great. And so rather than just eating acai 7 days a week, we want to diversify that diet. Maybe have blueberries one day, maybe have blackberries another, maybe have citrus fruit another for some other vitamin C sources. And so really thinking about food in the most diverse way, rather than relying on those few heavily marketed kind of products and food items. All right, now I know a lot of you wanted to talk about supplement use, and so we're gonna get to that at this time. So I did want to note this study. I found this to be an incredible number here. So one study of hepatocellular carcinoma patients showed that out of 146 patients, 71 of them have used supplements and have used vitamins, and 45% have used herbal supplements. Some of the most common ones used were antioxidants, multivitamins, vitamin D, and milk thistle. So looking at the evidence for cholangiocarcinoma specifically, this statement has been shown over and over again in all of the proper channels, including the American Cancer Society, that so far no dietary supplements have been shown to clearly help lower the risk of bile duct cancers from progressing or recurring. Now, that's not to say that there isn't a time and place for supplement use, and I do think that integrative medicine can always help introduce supplements safely if and when they're appropriate for things like symptom management, relief of side effects, and improving quality of life. Just to explain a little bit of the background of why we have to be a little bit conservative when it comes to supplement use. So natural supplements, just like medications, have to be metabolized by our body. The most common metabolism site for most medications and for most supplements is called the cytochrome P450 site. This is a site on our liver that metabolizes all of these products. If we have too many things going through this pathway, there's a very likely chance of drug-drug or drug-herb interactions and of liver toxicity, because too many things are being put through the liver to be metabolized. And so using verified sources to check where metabolism is occurring is really important when it comes to supplement use. So if you have a question about a supplement, really trying to speak openly to your providers, or if they're not sure of the answer, asking them to be referred to an integrative medicine provider for herbal management, so that somebody is helping you along with choosing the right supplements for yourself, and you're not doing that yourself. I always find this study to be so fascinating because out of almost 600 patients, only 6% have been asked, disclosed, and had any kind of documented supplement use. On the other hand, on our service in 2022, we prescribed 1,125 supplements to the MSK patients. This year, I think that number is going to be even higher. So this is just to show, again, there is a time and place for these things to be used, but in a safe, monitored fashion that's not going to be interfering with that CYP450 metabolism pathway, and that's not going to be creating any kind of interactions or interference with any chemotherapies or any medications. So I wanted you all to have this resource on hand here. We run a website called About Herbs, and this is managed by our pharmacist and botanical expert, and we're continually updating this database with all kinds of herbal formulations. I think we have about 300 at this point, and this shows an herb's traditional and proven uses, possible benefits, side effects, interactions, contraindications for use. And so I wanted to give you all that website here so that you can check that website when you're looking at, should I use this supplement? I heard about this one. What is it used for? What are possible side effects? You can always check something like a reputable source such as About Herbs before choosing to start a supplement. Oh no, sorry. Now I wanted to jump on here to talk a little bit about one supplement that I know a lot of people have questions about, and that is mistletoe. I know that mistletoe is getting a lot of publicity right now, and it's being talked about a lot. And I think that this answer is going to look really different in a couple of years. But for right now, we do need to know that the evidence behind mistletoe, even though it is commonly used, is just not there yet. I wanted to note here that very first bullet point is going to be the most recent study done on mistletoe. This was published just a couple of months ago, so very, very fresh and new. And it is only a phase 1 study. This phase 1 study had 21 patients in it, and they were looking to use 600 milligrams 3 times a week of intravenous mistletoe extract. This study did show improved quality of life and disease control, which means it is moving on to the phase 2 studies. Now, those phase 2 studies are going to evaluate dosing and safety, and it's really only after future research has been done that we can evaluate mistletoe for its safety, its efficacy, and we can go on to larger trials with it. So for right now, I guess my answer for mistletoe is that, again, I think this answer is going to look really different in the future when we have more evidence behind it. But for right now, unless you're participating in an active trial such as this one that's really looking at using it safely, I cannot recommend the use of mistletoe without that evidence behind it. On the other hand, I did want to talk about a supplement that we have tons of evidence for and research behind it that shows that it's a very safe supplement to use. So we know by a lot of different studies that a low serum level of vitamin D can be associated with an increased incidence of all GI tract cancers. Vitamin D levels are very easily checked with blood work by any of your medical providers, and we can supplement with either a prescription dose or over-the-counter vitamin D, depending on the levels. So to wrap up a little bit here on how to include integrative medicine into your daily care. So first and foremost, seeking out the integrative medicine team at your cancer center or at the nearest cancer center to you. Requesting referrals to nutrition and registered dietitians to help you with GI symptoms, food choices, and nutritional intake. Utilizing outside programs like Calm, Headspace, and different meditation apps to start using some mind-body therapies. Of course, talking to your providers openly about vitamins and supplement use, And if they don't know the answer to some of these questions, then they can help refer you to a provider on an integrative service that may have some answers. Making sure your vitamin D levels have been checked. And then utilizing different modalities such as acupuncture and medical massage for symptom management. Here's just another website for one of our programs where we have a lot of different mind-body practices, yoga, meditation, music therapy, Tai Chi, all of those classes are on there. So if that's something that you've been wanting to utilize and try, the resources are there for you to be able to include that. Thank you all so much for inviting me on today. I will be happy to answer any questions, and thank you for sharing your time.
Thank you, Lillian. We appreciate it so much. I invite anyone to put questions in the Q&A box or in the chat at this time, and we can ask them. So this is a good question. My experience when working with an integrative oncologist that insurance does not pay for the work. Can you please give some examples of when insurance pays for integrative work?
That's a great question. So I think that a lot of the insurance companies are going to, to change their tune on this as we do more research. So that example that I showed on, for ASCO's recommendation, if we're able to write in the medical notes that somebody has cancer-related pain, and we're using acupuncture, which is an official recommendation for its treatment, then this is something that needs to be covered. And so providing letters of necessity, providing that documentation that this is something that the patients have, I think that those are all chances for us to show the insurance companies that this does need to be covered. I would also encourage you, if you don't already work with a large center, to take a look at the research that they're doing. So for example, on our service, we have at least 3 or 4 acupuncture-based studies actively recruiting right now for different symptoms, whether it's brain fog or pain or trouble sleeping or GI symptoms. If you can enroll in a study, that absolutely is free acupuncture. So I think those are 2 different ways that we can help get around the issue of cost.
That is a good point. A lot of our patients look for clinical trials for treatment-wise, but it's nice to look for those reasons as well.
Absolutely.
Okay, you discussed herbal supplements, but what about probiotics? I'm thinking especially of, I'm not going to be able to pronounce this, Clostridium, the B word, B-U-T, Bitricum, commonly taken by the general public in the Far East, Japan, China, as a stomach remedy and found both in retrospective studies and in prospective trial to enhance the effects of immunotherapy.
Yeah, that's a great question. So this is something that we get asked all the time about gut health and about probiotic use. My personal preference is that we do try to, again, there's always a time and place for something like an official probiotic use. But I also do encourage everybody, for that sake of variety and diversity, to try to obtain some of those probiotic strains through foods. So through foods that have been fermented, so that you're always getting a little bit of a different strain of bacteria. A healthy gut is a really diverse gut. And so if you're constantly taking the same probiotic over and over again, you may have a lot of that strain in your gut, but that doesn't mean that your overall gut microbiome is really diverse and active. And so what we want to do is we want to feed those gut flora with good prebiotics, the foods that they like to eat, so fiber-rich foods. And we want to try to introduce new probiotic strains by including a lot of diversity of those probiotic-rich foods, things that have been fermented.
Okay. And this question comes up a lot. Are there any benefits to Rick Simpson oil outside the standard benefits of cannabis? Can you comment on that at all?
I can comment on the studies that have been done. And unfortunately, that is one of those things that is sort of touted as a curative type of use, where the evidence is really showing that that, cannabis oil and cannabis use can help in treatment of side effects such as pain, nausea, helping improve appetite, helping with sleep and anxiety. But those curative kinds of claims are not founded by evidence.
Okay. Someone wants to know if you can show the vitamin D slide again, or if not, if you want to send it to us, we can send it to them too, either way.
Sure. Yeah, I can add the attachment to the end.
Perfect. What is the level that platelets and white blood count levels should be that one should avoid acupuncture?
I think it depends on everyone's acupuncture team. For us, we stop acupuncture treatments when platelets are 25,000, I believe. And for the white count, it is based on the absolute neutrophil count. So it really depends, I think, on your acupuncture team. Everybody should have their own guidelines for when they are holding this treatment.
Okay, and another question on the vitamin D slide. I must have missed that one. Did I understand the slide correctly that vitamin D is linked to an increase in GI cancers?
No, I'm sorry. So low levels of vitamin D have been linked to an increase in GI cancers.
Okay.
So we want to make sure that everybody's vitamin D levels are at a good level in their blood. This is something that we used to be able to obtain through sun, but through the years and with genetics, our skin absorbs vitamin D a lot less than before. So most of us do need some kind of supplementation. And this is a really safe and easy vitamin to be able to supplement. It's not going to interfere or interact with treatment. So as long as, there's no clause on your research trial that you can't have, any kind of vitamin on board, I don't see any downsides to having this checked and making sure that it's at a good level. And if not, supplementing with it.
Okay. So if you're in remission and want to use acupuncture or Reiki for another issue, is there any studies saying whether this can harm your cancer or potentially take you out of remission?
Absolutely not. Definitely not. So this is, I'm so glad that somebody asked this. We have had so many patients, come to us and say that they went somewhere to an outside provider, and they were told things like, we can't do medical massage on you because we're going to spread the cancer. Claims like that are completely unfounded and untrue, and same goes for acupuncture. This is absolutely something that you can use either during active treatment or afterwards while you're in remission to help improve whatever symptoms we may be targeting. It could be anxiety of recurrence. It could be trouble sleeping. It could be, lingering side effects of treatment. So whatever the symptoms are that we're using it for, not only can it be beneficial for it, but it is absolutely safe to use for that remission state.
Thank you. Are there herbal medicinals recommended and prescribed at MSK, mostly single ingredients or formulations? And are TCM formulas and herbs used alongside acupuncture, since they are well represented in MSK's About Herbs resource?
Absolutely. So I would say yes to all of those questions. So we utilize herbs as single herbs or vitamins. So we can use that vitamin D, for example. If somebody's vitamin D is low, I may suggest, a certain amount of a single vitamin D supplementation. We use TCM, and for those of you who are not familiar with TCM, that is traditional Chinese medicine herbs. Those are most commonly a formulation of herbal formulas. So there could be, 2 to 6 different herbs within that formula. TCM formulas are often used for more symptom-specific management. And so we're using those TCM formulas for a short period of time to help treat that specific symptom. So yes, that's absolutely something that we do.
Thank you. What would you consider an adequate vitamin D level?
So it depends on your testing in your laboratory within your center. So I don't want to give an exact number because different laboratories may have different normal ranges. There is a very clear normal range though when it does come back from the lab.
Okay. Does marijuana reduce pain and help with cancer?
That's a great question. So I would say that the evidence does show that there is some benefit to both CBD and THC for symptoms such as pain, sleep, stress, anxiety, appetite, nausea. But there is no evidence that shows that it actually helps reduce that recurrence risk of cancer or from cancer coming on in the first place.
Okay, you said nutrition choices to lower recurrence risk. Please repeat what those choices are again.
Yeah, so this is a little bit of a tough question. So, for some of the other populations, there are some really clear evidence and studies looking at certain food choices making a really specific difference in reduction of recurrence. For cholangiocarcinoma, that evidence is still lacking. So it's something that we need to be looking into. From what I could tell, I would say the things that seem to me make the most sense in the research are a higher fiber diet, lower glycemic index carbohydrates, and lower saturated fat. So these were the things that really seem to come up over and over again in some of the diet studies relating to this specific type of cancer. So those are the things that I would be focused on in diet changes.
Okay, thank you. A question from Facebook. You mentioned acupuncture, but do you have any suggestion or thoughts on dry needling or cupping? Is it one in the same? And also, what about Reiki, or is it Qigong?
Qigong. Mm-hmm.
Okay, that one.
Yeah, so Qigong, Qigong, Tai Chi, yoga, those are all part of our mind-body therapies. And so we have those on, so we have something on our service called Integrative Medicine at Home, or I Am at Home. That's our daily live classes program. And it has all of those kinds of mind-body therapies on there. So we absolutely encourage the use of those kinds of restorative, gentle movements. Qigong, Tai Chi, yoga, meditation, they're all really working underlyingly on the same sort of pathway in reducing that inflammation, in improving that flow of energy, improving that flow of qi as acupuncture. We don't do cupping on our service or dry needling. We do use acupressure when we're not able to do acupuncture. Maybe somebody is fearful of needles, or maybe platelet counts are prohibiting us from using needles. So we do use acupressure. But I would say, if you're going to an outside provider and are using things like cupping for help with pain relief alongside with acupuncture, that's absolutely fine.
Okay, and do you have any information on the For Life supplements?
So I'm not going to be able to speak about, specific brands. I do want to just encourage everybody to do their due diligence when choosing supplements and vitamins. I'll give you a couple of resources to be able to sort of, best make those decisions for yourselves. I already showed you the About Herbs website. I'll pull that, I can pull that link up again. But the other couple of things that everybody can do is you can always reach out to a company or a brand and ask for something called a certificate of analysis, or a COA. That COA is going to be able to tell you any testing that they've done on that batch or lot for that supplement. So if they're not asking you what batch number or lot number you're asking about, that should be your first red flag that they're not giving out, very clear COAs, right? The testing should be done on every lot, just like it is on food, right? When we have a food recall on frozen fruit or a bag of lettuce or something along those lines, it always has, this is effective for these lot numbers. And then everybody is able to go on their bag of frozen fruit and see if yours is affected. The same thing should be done for supplements. And so asking the companies for those COAs to make sure that there are no heavy metals, preservatives, pesticides, or anything in those supplements is really important so that you know what you're putting into your body. Another website that I think is really powerful and a great way to compare different supplements and to see what testing has been done on them is Consumer Labs. ConsumerLabs.com is able to pull up any research that has been done on that brand. It's able to tell you any negative things that have been found in it. So any preservatives, any contamination, and then it can tell you even, maybe this brand has been shown to be contaminated 60% of the time. Here's another brand that maybe doesn't have as much contamination. So Consumer Labs, I think, is a really powerful website.
All right, thank you. Have you heard of turkey tail mushrooms? Can you give us any information about that?
I can give a little bit of information on that. So that is our most commonly prescribed supplement on our service at MSK. I will say that, but I will say again, it is prescribed with knowing a patient's treatment plan, medication use, immunotherapy versus chemotherapy use. And so there are times where we don't suggest it. So just always check with a provider before starting it. Another thing that I will also say is, not all mushrooms are created equal. And so not all supplements are created equal. And so making sure that we're getting a brand of a mushroom supplement that really emphasizes the use of the active ingredient portions of the mushrooms, that fruiting body, and doesn't use a lot of the other, extra things. So if you think about it, some brands might try to do, the farming a little bit on the, the quick and dirty side. And so if they're grinding up everything from the soil, the tree trunk, the root system, the fruiting body, and calling it a mushroom supplement, well, how much of that is the active ingredient, which is only found in that fruiting body? And so there's a lot of thought that has to go into choosing a brand that is really doing their due diligence in making sure that when they are harvesting those mushrooms for the supplements, that they're only getting that part of the mushroom where the active ingredient is found.
Right. Any general guidance in what can affect absorption of clinical trial meds such as targeted therapy, or is it a case-by-case basis?
Yeah, I think that is really a case-by-case basis. I know that there's so much being looked into the gut microbiome, and that is, we know that affects it, but to what degree and how to change yours, that's a little bit more, more individualized. But I would say, of everything, that's sort of the first thing that comes to my mind.
Okay, a couple more mushroom questions. Didn't realize there was so many. Any evidence regarding tiger tail mushroom as a complement to chemotherapy, specifically for the gemcis or FOLFOX? And then there was another question on chaga mushrooms, CHAGA.
So I think that one important thing to know is all mushrooms technically have these special fibers in them that sort of do that active ingredient work of either boosting the immune system or, or whatever it may be. It's just that certain mushrooms have more evidence behind them than others. So we don't use those particularly on our service. That's not to say that there may not be any research behind them. We do tend to use turkey tail a lot more because of the strong amount of evidence behind it. So it's really about what mushroom sources have had that research done and what the evidence shows.
All right. Any information you can provide on vitamin C infusions and your thoughts on that? And then anything on Boswellia, BOSWELLA?
So again, I don't know if I can answer much about like a specific supplement like Boswellia. It is a commonly used supplement for different reasons like anti-inflammatory properties. but, not knowing a specific case, I can't really speak to, whether or not I think it could be, beneficial or even safe to use. We again recommending that you check about herbs for drug herb interactions, noting where that metabolism is happening for Boswellia, noting if it has side effects like lowering platelets, for example. That's a really common one that people forget about, and so many herbs have that platelet effect. And so if you're somebody who's already struggling with low platelets because of treatment, the last thing we want to do is get an herb on board that's also going to cause, platelets to be low. So just something to keep in mind. Always check those resources first before starting anything. And then the vitamin C infusions, I would say that's a really similar answer to mistletoe. And if you were to choose to do a therapy like that, having it done through a proper research study, like that one I showed for mistletoe extract, rather than just going somewhere and having that infused.
Okay, thank you. Are there any specific benefits to walking over other types of exercise?
That's a really great question. So I think that all different exercise has different benefits. So if we're talking about weight-bearing exercise, we could be improving bone health and muscle strength. If we're talking about restorative movements like Tai Chi and yoga and Qigong, we can also have that sort of de-stressing mind-body kind of benefit where it's working on, anti-inflammatory properties and relaxing the body. Walking is a great, method for exercise. There's absolutely nothing wrong with it. So it's really just about finding your right method, and maybe even mixing it up a little bit. If you only ever do walking and you're interested in Tai Chi, give that a try so that you can have a little bit of a different benefit from a Tai Chi class than you would walking.
Okay. And last question, if there's anyone else who has any more questions, feel free to put them in. We have a few more minutes, but any benefits to intermittent fasting with cholangiocarcinoma or for other cancer? And then I'm going to just throw out the ketogenic diet as well, while we're on the topic.
So yeah, so that's both really, really good questions. So I would say for the intermittent fasting studies, there are some studies showing benefit of intermittent fasting. They are there, especially in breast cancer and in ovarian cancers and a few others. It really depends. It really is very patient specific, right? If I have somebody in front of me who's already having a hard time eating, they're having treatment related GI issues, they're only able to take in certain things, the last thing I'm going to do is now shorten the window of time that they're able to eat as well, right? I don't see how that could be beneficial. What I will say is one thing that I do promote pretty much for everybody is trying to avoid, late night eating and trying to avoid eating right before bed. So having that three-hour window before bedtime so that you're not digesting when you're trying to sleep, and so that you're sleeping more restfully and you're able to be in a deeper state of sleep rather than working on digestion. So as far as intermittent fasting, there are benefits to weight loss and to a lot of other cancers with it, but it really is very patient specific. And then the keto diet, I would say, again, very, very patient specific. In general, not something that I heavily recommend, because when we look at most cancers across the board, and we look at all of the diet studies that have ever really been done, they really do all show the importance of fiber, whole grains, legumes, lentils, beans, high fiber fruits and vegetables, all of these really powerful anti-inflammatory foods that diets like the keto diet cut out. And so these are foods that I want everybody to incorporate into their diet. They're great prebiotics, they're great fiber sources. And so I just worry that somebody doing a keto diet is not getting enough of those foods and also unnecessarily cutting them out. And so I think that we sort of have given carbohydrates a really bad rep, but it's a matter of where are your carbs coming from? Are they coming from processed refined things like, cookies and pizza and breads and things? Or are they coming from those true whole grains, from lentils, from beans, from carb heavy vegetables? That's very different. Those are things that are processed very differently on your body. And so just saying carbs are the enemy as a general statement, I think has kind of gotten away from us. And so it's really a matter, in my opinion, of where are the carbs coming from. So I don't typically recommend a keto diet unless it's for very specific reasons.
Thank you. Is capsaicin, I don't know how to say that. Is it a good supplement? I don't think she spelled it right either, but capsaicin, I want to say it's the turmeric one, maybe. Supplement.
We use capsaicin for pain relief. We have it in our herbal pain patch. A lot of like topical products will have the capsaicin in them that helps with pain relief because it has that like heating property. So it could be good for muscle pains or things like that. I'm not sure what they mean by supplement though. So I would just be cautious when we think about capsaicin. In my mind, I'm thinking about it more from like a topical use standpoint.
Okay. And then how would you suggest if somebody is wanting to find an acupuncturist, how do you find a reputable one to work with?
Really great question. So I would say, first and foremost, check with the integrative medicine teams at your local cancer centers. So at this point, every large cancer center or medical center does have an integrative medicine team. If they don't have as part of their team their own acupuncturists like we do, they should be able to, refer you to specific ones. You always want to make sure it's a licensed acupuncturist. That's always going to be the first and foremost thing. There are some times where, for us being in New York, patients may live a little bit further away. It's difficult for them to come into the city. So sometimes we will even, have them see somebody on the outside who has been vetted and trusted by somebody on our team. Maybe they've done some training with us. And so on. And so just speaking with your integrative team or the closest integrative team that, that is to you to see if they do recommend somebody, if they don't have somebody on their team.
Okay, perfect. That was our last question. Thank you so much, Lillian, for a great presentation. And we can share the slides if you have permission to do that with people who wanted it. I know they were curious about that vitamin D slide. And also, again, the app or the link was about herbs to be able to check.
Yeah, and so what I can do is I think that I went really quickly at the end there. So I think I skipped over my second to last slide. My second to last slide has all of the links that I think you might find helpful just right there in one slide so that they're all right there for you. So when you get the slides, you're going to be able to see that on that one slide, all of the links. Mm-hmm.
We will make sure to share that with anyone who would like that and post it on with the recording. So thank you again for your presentation and taking the time to share your information with us.
Thank you so much, everyone. Thank you
you're
for
welcome.
having me and such great questions, everybody.
Awesome. Thank you so much. Have a great day.
Thanks, Melinda. You too. Bye-bye, everyone.
Bye-bye.